Greetings, friends and colleagues, network members. This is Sam Collins for Cairo Secure, your coding and billing expert, the way to hopefully help your practice grow, thrive, and of course, always do a little bit more, a little bit better for you and for your patients. I want to talk about this time around something that's come up quite a bit for questions to me, particularly from network members and at seminars. And it's Sam, how many services is reasonable? What can I get paid for per visit? How many? What's the limit? Is there a limit? And I want to get into that a little bit to make sure there's a good understanding. Obviously, it always comes back to medical necessity, but I do think it's reasonable to start to understand what does a carrier look for? What do we really consider reasonable? So let's go to the slides. Let's talk about it. Let's talk about what is reasonable for the amount of treatment per visit. Again, what should I do? Can I do 6 services, 10 services? How many units? What is going on here? What do I need to do? Well, let's talk first about what things that we're going to do. In chiropractic, of course, I think the number one thing, and it's almost a given, is you're going to do a chiropractic manipulation. Now, it's not always that you have to. In order to do care, sometimes you may do a therapy only. Maybe you will do an exam and no treatment other than that. However, most often, are we going to do a chiropractic manipulation? So, absolutely. It's what we do that's unique. I want to emphasize that. Think of it as a patient. If I'm coming to a chiropractor, guess why I'm going? I want a chiropractic adjustment. It's what makes it unique. If you think of it, why are we in chiropractic practice if what we're doing is not unique? Because my goodness, if massage worked, why would we even be here? If all these therapies, obviously chiropractic makes the biggest difference. In fact, if you look at most studies, in fact, I'll say the latest studies on what is the best care for lower back pain, it highlights 2 things that are the best in combination. And that is chiropractic with, meaning the adjustment, with some type of active care or exercise. Exercise alone is not as effective. This is part of the reason physical therapists will want to so much do manipulation. So, bottom line is, of course, always a manipulation, not going to be an issue. I think manipulation also fits during any part of the care plan, whether it's at the acute, the chronic, the long term, it's going to fit within that. It really fits in any phase of it. However, let's keep in mind, can you get paid for 2 manipulations in one day? No. If you manipulate someone twice in a day, that's fine. Will an insurance cover it for 2 times a day? No. If you wanted to charge the patient for the extra, I guess you could, assuming you are out of network, so long as they understood that. But for the most part, it's going to be one per day. So even if you try to go back with 2, my dad being a chiropractor, I remember him often having a patient come in the morning. And then he would tell them, hey, come back in the afternoon. I want to make sure this adjustment holds. He'd come back and he'd adjust them in the afternoon. He felt it held better. Did he bill separately for it? No, that's just what he did. Now, when it comes to the things I think I really want to emphasize, though, is how many of the services can we do? A manipulation, of course, is a given. But what about therapies? What is the limit? Can I do 2 or 4? Well, let's kind of break them down and what types of therapies we're going to do. I'd say the common therapy or a modality, if you will, the passive care, those you're probably going to do 1 per visit. They're passive care. Think of it. What is the purpose of heat? Well, relax the muscles, reduce pain. Okay, increase range of motion. I kind of like that because the air is relaxed. But then what's the purpose of electric stim? Relax the muscles, reduce the pain, maybe some inflammatory changes. So you notice there's a lot of duplication. So it generally, you're going to, for a passive modality, you're going to do 1 per visit. In fact, I would caution, I wouldn't even do 2. Now, maybe if they're to separate areas, I guess so. Maybe you did electric stim to the knee, but then some other something else to the neck, maybe. But you're never going to do 2 in one area. And that is something that definitely is always seen by insurance. If you do multiple passive modalities, they're seen as duplicative, meaning they're doing the same thing. So the why. So when it comes to passive care, I'm going to say 1, and that would be about the max. And remember, those you don't get billed for extra units, so it's 1 maximum. Now, the other therapies, of course, that we do are called procedures, or they're active care, kind of hands-on, if you will. Now, obviously, that can include massage, though. So is massage active care? Well, it is, but it's somewhat passive because if you think of it, what's the purpose of massage? Muscle relaxation, okay, pain management. So kind of duplicates. Nonetheless, I do think it's reasonable to have that. But hands-on procedures, what I want to hit here is they are timed in 15 minutes. So therefore, depending on the amount of time you spend, of course, you can do additional units. So therefore, what's reasonable? Well, if you told me someone who was coming in and they're getting massage, would 15 minutes be sufficient? In some instances, yes, but in others, it might be 30 minutes. So it's not unreasonable to do more. Now, to give you the highlight, there's something we called the medically unlikely edits. It's things that can be done or the maximum that can be allowed. For massage, actually, the maximum per visit per CPT, per AMA, and per Medicare for that matter. I know we're not paid by Medicare, but we're talking under the maximum guidelines. They're going to say 4 to 6 units per visit. So you're thinking, oh, so would it be unreasonable in some instances if someone came in, they had a chiropractic adjustment, then 4 units of massage? I would say no. I mean, that's a lot of services. Yes, that's an hour plus, but nonetheless, is it reasonable? Is the purpose behind it? So, therefore, what would I say is going to be a maximum? You'll probably have heard this quite a bit. It's probably about 4 services per visit. Now, where does that come from? Well, some insurance carriers actually limit that. We'll get into that. But I would say 4 is about reasonable, that there could be instances for more. Because what if you're putting a person through some active care? And I mean true active care, like exercise. Would anyone ever say, my God, I did exercise for 15 minutes and man, that really worked. I'm in great shape? I don't think so. This is why, if you look at a physical therapy facility, they're not doing 15-minute increments of exercise. In fact, it's not uncommon for them to do probably an hour, 45 minutes, sometimes even more. The maximum per exercise per visit that's allowed is up to 6 units. Does that mean we need to do 6? No. But it means that could it be potentially reasonable if you give me the purposes? Like if you're doing a rehab post surgical shoulder or knee, it may take that much considering the warm up, the actual exercise, the cool down, some things to reduce swelling. Yeah, that can certainly add up. What I'm going to suggest is start to think along the lines of what is my purpose, but also what are the carriers expecting? Now, not everything is dependent upon insurance, but obviously, if they're paying the bill, we have to consider it. Well, I will tell you, when it comes to Aetna, Aetna actually publishes they're going to pay a maximum of 4 per visit. 4. So you can do more than 4, but they're going to push back. Now, could you potentially try to argue, hey, need a little bit more? Yes, but it's not an argument I like to make to always be on the upper end. I would say if you've got probably between an adjustment and 2 to 3 services or units per visit, I think you're going to be fine. I don't think you should run into much issue. Again, so long as you can put together the purpose, the goal, the why. Now, Anthem Blue Cross Blue Shield, a little bit different depending on the plans. There are some plans, and I'll give an example. Blue Shield of California actually allows 5 therapies per visit, so a maximum of 6. Does that mean you need to do that many? No, but it does mean that it's reasonable, or at least potentially reasonable. What I would say is always look at what can I show as necessary. It's not just, oh, good, what's the maximum I can bill? One of the questions I get, well, Sam, what's the most I can get? I get that. There's still a business end of this, but I always got to think, what do I need to really effectuate this patient in the best way? What's going to give me the outcome? And I would say if you're focusing on active care, it's not unusual to see 2 units of exercise, maybe in a passive therapy on that visit. What about personal injury, though? Personal injury could be a bit more aggressive. Someone comes in with a pretty significant injury. You may be doing a lot more care for that person. One, they have multiple areas. So I'm not going to put an absolute limit to say that show me what's reasonable. And again, I would say on average, probably 4 services units per visit is fine. But can there be instances for more? Absolutely. Talk about severity, talk about multiple areas that can come into play. You'll see this comes back to making sure we can justify. Where you want to be careful is what if your bills are always on the upper end? Remember, pigs get fat, hogs get slaughtered. And it doesn't mean that because you do more, that's necessarily a problem. But can you justify it? If you always are showing doing a much higher level, is that going to create more where someone wants to look at what you're doing? Now, I'm not talking from just an insurance standpoint, but could the state board be involved? Absolutely. For those of you, obviously your malpractice helps to cover you when it comes to audits. One of the things I deal with audits often is the board coming in saying, this provider has provided too many services per visit or too long of services because the patient has maybe made a complaint. That could be an issue. But for personal injury, I would say certainly the patient probably is going to be a bit more aggressive based on the number of areas, based on severity, of course, too. But keep in mind also, for that reason, there's going to be more. But should there be a tapering? Probably as they get better. Work comp, for instance, generally is going to accept up to 4 services per visit. So again, probably in that range. What I would say the ultimate answer is going to be, tell me the purpose. Tell me the why. If you can demonstrate why the person needs an hour and a half of massage and that fits, I'm going to say, okay, maybe. But start to think, does that seem reasonable? Just because something is a possibility doesn't make it a probability. So always think of, what are my goals? What am I trying to accomplish? And I always emphasize active care. If you're going to really strengthen a region, stabilize it, increase flexibility, strength, tensile strength, if you will, is that going to happen in a 15-minute program? I'm not so sure. I'm going to say probably 30 minutes. I've never seen anyone go into the gym going, wow, I worked out for 20 minutes and I'm doing great. As a starting point, maybe, but I'm certainly going to say don't be afraid to be aggressive. Just make sure you always got your reasoning behind it. So, to answer it succinctly, what I'm going to tell you is if you're doing probably 4 or less services or units per visit, you're going to be in a safe range. If you bill above that, and I'm not saying not to, make sure you're going to have more to justify. But realize, even if you're billing 4, do you still have to kind of go the why? Not just because I like to. Think of what is the purpose of certain types of care. If you're doing passive care, way into the course of care, I'm going to question why. Why are we doing massage 6 weeks into care? Because if we're still dealing with spasm and we're still dealing with the issues that massage is doing, I don't think our care is working. Whereas we're going to move it to the active or rehabilitation. And by the way, does rehabilitation pay a little bit better? It does. It has a higher RVU and you're going to have less pushback. So keep in mind when you're doing care, look at yourself and go, does this appear reasonable? Can I justify this? Or am I just a billing monster? Hey, I need to make sure I'm getting 200 per visit. I'm exaggerating that, but not really. There are some offices that do bill that much. I don't think it's unreasonable if you give the justification. Keep in the safe range. If you're doing an adjustment, 2 to 3 services, not much of an issue. Just transitioning from passive to active, I think is perfectly good. Just be mindful. If you are billing more, you have more scrutiny, be prepared. I'm not saying it's ever wrong. Just make sure you have the data to support it. Nothing wrong with doing the care that's going to help the patient. Show me a good outcome. With that in mind, network members, of course, always reach out to me. But if you're not a member of the network, join. Make me part of your staff. I become part of your team. Let's make sure your office is always thriving by having the right answers, the correct answers, so you're always maximizing your services and, of course, your payments. Until next time, my friends, take care.